So something that I'm not seeing explained too often is the role of the clavicle within the context of nerve-related issues. So a lot of different individuals might feel some type of nerve-related symptom, whether or not it's numbness, pins and needles, lack of sensation, or any burning down through the whole arm. A lot of different individuals might look at the scapular position, might even look towards the muscular regions involved. But one thing that I'm not really seeing too much from many individuals is the role of the clavicle and how we can improve this guy right here. Many individuals might have a good ability to improve upon what's going on at the neck, but even that does not necessarily look at the mechanics of the clavicle, because they're quite literally two different regions while they are adjacent to each other. So one thing I wanted to go over is the mechanics of it, and just very simply describe what's going on first in the normal mechanics of it, and then maybe the patho or the abnormal mechanics that might occur. So within the clavicle, we have a couple different motions. Using this kind of drawing here, if this is the clavicle, this is an upward motion, this is a downward motion. This red arrow is meaning the clavicle can go backwards. The forward one means it can go forwards. And then we have some arrows with some rotation lines here. So this means it rotates backwards and then it rotates forwards. So the reason why I bring that up is if an individual might present with a certain posture, there are different structures that might be kind of infringed upon. They might experience compression. Namely, we have a whole bunch of different nerves in this region named the brachial plexus that kind of pass underneath the clavicle. So if we have an individual that might be presenting with kind of a downward presentation of the clavicle, we're actually thinking that the nerves might be compressed. So if the nerves are compressed right here and the individual might have sensation down their arm in whatever fashion, yes, we can look towards the hand, we can look towards the elbow, we can look even towards the biceps and triceps, but what is also going on here at the clavicle and maybe even the neck. So there are a lot of different regions we can identify. It's best to kind of identify all of them, yes, but just for today's purpose, I'm going to talk about what can happen at the clavicle. So I have clavicle drawing here with some other lines drawn through it. So when there's this elevation, in this case, when there's shoulder flexion, say that I bring my arm up into the air, there are certain motions that occur. It's not just as simply as saying, oh, my arm moves up. Well, your arm consists of many different things, namely the scapula. Yes, you get upper rotation of the scapula, but again, we're going to be identifying what happens at the clavicle. So if my clavicle doesn't move when I bring my arm up, this brings into question, are there certain structures that are kind of clamping down on this clavicle? And there are different muscles that attach there. It could be the pecs, could be the deltoid, could be limiting motion at the clavicle, could be upper trap, could be a lot of different things. So going back to shoulder flexion, in this case going upwards, what happens with the clavicle? We get elevation and we get posterior rotation of the clavicle. So if I use this marker as an example, elevation just on its own would look like this. So this is the distal end of the clavicle and this is the proximal end of the clavicle. As I go into elevation, this happens. But not just going up. If this goes up, something else has to go down. So this end has to go a little bit inferior and this has to go a little bit superior. So it goes up. So that has to happen. There's also some other motions that occur with shoulder flexion. Posterior rotation. So if you see the label here of the marker, there needs to be this motion occurring as I bring my arm upwards. So there needs to be this simultaneous elevation and posterior rotation. So there's a lot of things involved with this now because we're adding different planes. This goes up and then it goes back. So it has to tip backwards. This end has to go down to some degree and then rotate inwards. So it has to go like this. So it's rotating as I go through those motions. So with that being said, if we're getting this motion and it's rotating as well, there are different structures that assist with this. So if I don't have the appropriate muscular integrity of certain muscles, these guys need to, one, either be inhibited or enacted upon to allow for greater range of motion to occur so that I can allow for this clavicle to have greater range of motion and to have ease of movement, right? This freedom of movement. So what we're going to try to do is understand that as we bring our arm up, we do need some representation of elevation, posterior rotation as I come up. So these things over time will hopefully allow better motion for this to occur. And this right here is called the first rib. So it's a shadow of it, if it makes sense. Because if we are compressing on different structures, this first rib and this clavicle are very tightly bound together. As we get this elevation going, we do need the first rib to stay in place, and we do need the clavicle to move independently of the first rib, because the clavicle is not a rib. So as we get this motion, we do need the rib cage to stay down. We're not going to bring the whole rib cage with us when we elevate our arm. So there are a lot of things involved with this motion, and I think that if we start to understand what happens with the clavicle, we're going to get a better understanding of how we can improve how our clients and athletes feel.